Hi guys, I know a lot of you have been looking forward to my next update. Yesterday was my Huntsman appointment and I went up to see Dr. Cohen and his team, and that was Rob's old doctor. The appointment went really well. It was really good to see all of them and to be there with them. My Dr. Cohen there had been talking with my surgeon here locally in town, and he thinks that the best decision at this point for me is to still try to do surgery first, which was our initial plan. After my surgeon went back and looked at the MRI, she thinks she's going to be able to get the clear margins that she needs. She'll need to take a little extra skin, and the only concerning part about that, one of the tumors is really close to the skin, and so to get a clean margin she's going to have to take some skin. And the only concerning part about that was I'm doing reconstruction with the mastectomy, and they need enough skin to be able to put the expander in place at the same time. But after looking at the MRI and talking with Dr. Cohen and his recommendation of doing the surgery first, my surgeon feels comfortable proceeding with the surgery. And that was his top recommendation for me right now, is to do the surgery, then get the pathology back from the tumors, and also send them away to either Oncotype or MammoPrint, which is a place that runs all this genetic testing on the tumor and kind of comes back with like a score or percentage rate to tell you if you should do chemotherapy or not. A lot of breast cancer tumors are caught early and are early stage in grade, and they're also hormone receptor positive, which means estrogen and progesterone help them grow. And a lot of times with those kind of tumors, chemotherapy, even if you use it, doesn't help, won't touch them. So that is the concern with mine, that they could possibly come back in a category where I wouldn't need chemotherapy at all, which would be amazing. I would love for that to happen. So that's what you guys need to be praying for right now, is that my tumors are going to come back and they are not going to need the chemotherapy. I'm not trying to get out of the chemo. If I need it, I will do it. But the concern has been that I've already had the chemotherapy before, and that's what makes me nervous about that. So right after I saw Dr. Cohen up at Huntsman, I came back down here and saw my surgeon because that's kind of the route that I was thinking I wanted to go. And she was able to squeeze me in at the end of her day yesterday and talk with her and get me on her schedule for a week from today, next Wednesday, April 26th. So I have decided to do a double mastectomy, and so with reconstruction at the same time. So what that means is the surgeon will come in and she will take the breast tissue on both sides, and then the plastic surgeon will come in after her at the same time during the same surgery and put expanders under my skin and then sew me back up. And then slowly over the next few months they're going to stretch that skin with liquid that they put into the expanders till I get to the size that I want to be for my reconstructed breasts. So that is the plan right now. I feel really peaceful about the plan, and I feel a lot better about it going in this direction. That way I'll really know if the benefit of the chemotherapy is going to be there or not. So that's good news. I also found out about my genetic testing. I got mostly more good news back with that. I'm BRCA 1 and 2 negative. There was one other, they test you for those two main ones and then I think 20 other ones. And there was one other one that I came back slightly mutated for, but it was a very slight mutation, and they don't have enough research right now or enough people that have that tiny, tiny mutation that I have on that gene to even know if it's a cancer-causing source of a gene yet with that mutation. So it's not really something for me to be worried about right now for my sisters or my children or anybody in my family. It's just kind of something that I need to keep in the back of my mind and know to check on. He said in the coming years, hopefully they'll have more data, but right now there's just not enough people with that very slight mutation, and the ones that are coming up with it in the database are healthy. So there's no link to cancer with that yet. Which is good to know. Just something I need to think about and be aware of in the future, and keep checking back so they can check the database for me and see if there's any new findings. Just, every year maybe check with them, because they could get new data and more people coming in with the genetic testing. So that's good to know. I also found out that the polyp they removed during the egg retrieval came back negative, so that was good as well. So I've had a lot of good things happening this week. I feel like I'm finally progressing in my treatment and what we're going to do. And now that I actually have the date set for this surgery, that makes me happy too. So yeah, everything's moving along and going well. Doesn't mean I don't have bad days or I'm not anxious about all this coming up. This is still a lot of big things happening and going on. So my anxiety creeps up some days, and got to calm myself down. But for the most part, like I said, I feel peaceful about the way things are going. We had a good Easter weekend with the girls and spent some time with our family, so that was nice. Holidays are usually hard, and this is the first year of holidays without their dad, but they did really well, and they had a good Easter, so that was nice. So I don't really have any much more to tell you at this point. I just want to continue to thank you all for your love and your support and your prayers. And someone sent me flowers the other day, and I just keep getting lots of calls and text messages, and I really feel everyone's love, and it means a lot to me. Because as strong as I may look or feel, it's still hard. And so I appreciate all those prayers that are coming in to help me and bringing me that peace that I do feel from time to time. So thank you for all of your love and support and prayers and everything that you guys are doing from near and far as I continue on this, what seems like very slow starting journey. Just want to start this so I can end it. And the beginning will be next Wednesday, so that will be good. So hopefully I'll be able to give you guys some updates. I'll feel well enough to give you guys some updates from the hospital. I'll bring my iPad with me and just kind of let you guys know how I'm doing and how I feel after having both my boobs cut off. So anyways, if something comes up before next week, or I just feel like sharing anything else with you, I will. But if not, probably plan on hearing from me towards the end of next week after surgery. Okay, bye.